Module 2, Collecting Data. This module is designed to provide information on the collection of safety-related data. The data collection process will be explained, particularly current good practice in collecting data from police. Other sources of information, including hospital data, will also be highlighted. The steps required in the collection of this data, including assessing stakeholder needs, will be explored. Dr. Turner will start Module 2.
Okay, so our next session now is on collecting data. So just as an overview for this module, we'll be talking about the need to assess stakeholder needs and the current data collection. Who are the important people when it comes to collecting data? Who do we need to be talking to? Who can help us? I think a very obvious one that we all know about is the police. Other ones include hospitals, but we'll talk about others as well. There are many, many different people involved in road safety, and all of these people have some role to play in the data. Our main source of data, as we've already said, comes from the police usually, but also information from hospitals and other sources. Just keep in mind also, though, that we're talking about the non-crash data. So information like the road environment. This is very important for us to understand the quality of our roads. What are the speeds of vehicles on our roads? What is the seatbelt wearing like for people in our vehicles? What is the helmet wearing rates? To step into the first step, the guide on data systems is by the World Health Organization. They recommend that a situational assessment be undertaken, and that this is involving 4 steps. A lot of this requires the need for a lead agency. It is very important to identify who is responsible, who is going to coordinate all of this information. And it may be this collection is shared by many organisations, but someone or some organisation must be responsible to make sure this happens. And this is what we refer to as a lead agency. So the 4 stages outlined are that we need to do a stakeholder analysis. Who are the important people? We need to assess our data sources and the existing data and systems that we have, but also the quality of the information that we have. Sometimes we collect information, but it is not very good. Often this is the case. The 3rd step in the process in this document is to do an end user needs assessment. Who will use this information? How will they use it? Why do they need it? And we must understand this before we start to collect data. The last point is about, and it's called an environmental analysis in the document. I don't think this is a very useful title, it's hard to understand. But it's about the relationships, the political element, the working with the police or getting the right funding from government to collect this information, and about forming the partnerships that we need to collect and use this information. Stakeholder analysis. Identify organisations and individuals who have an interest in the collection and or the use of road safety data. So this is 2 different types of people. Some people may already collect this information. Other different groups may use it, but they may be the same people. So we have a mixture of people who collect and use information. We must have an understanding of these different groups. They can help us in road safety. Examine and assess the roles and the activities. What are these people doing with this information? Do we really need it? It costs us money. Do we really need to collect this information? Or do we need to collect more information to help them do what they need to do to help us in road safety? And we also need to decide how the different stakeholders should be involved in the process. Should they be collecting information? Should they be analysing it? Should they be producing reports for government? Should they be helping with training? So an understanding of all these different activities. Who are the stakeholders? Who are the people that are involved in the collection and the use of road safety data? I think immediately you will think of the police. They are probably the most important stakeholder in terms of crash data, particularly. But there are others. And in the notes in our resource book, you'll see the notes there about other stakeholders. These include people from the hospitals and the health service, so trauma specialists and other doctors. They use this information. They collect this information. Epidemiologists and public health specialists in injury prevention, again, the hospital and the health sector, collect this information for us, and they use this information. Engineers who build the roads, road safety engineers who improve safety on our roads, use this information. And sometimes they also collect information for us as well. Representatives of National Statistics Office. Sometimes our countries have got organisations whose role it is to gather information and exchange information. They may already collect information that we can use in road safety. We need to be aware of what they're collecting, aware of how they use this information as well. And they may have some skills and some people who we can use to help analyse our safety problems as well. The insurance industry, they collect information as well. So sometimes people insure their vehicles in case of an accident. When an accident happens, insurance companies often collect information about the accident, so we can use this information. But they can also use this information to help us improve safety as well. So they are collectors and users of information. Non-government organisations, the people that help in education programs and training, sometimes they can help us collect information, perhaps on helmet wearing, perhaps on other issues. They can help us in the training and education programs as well, and they need our information that we collect. Academic institutions like universities, they can help us analyse information. They can also collect further information. They can help us do surveys. They could help us do a survey on the number of children who are wearing helmets on motorbikes. They have an interest in this sort of research. And also the automobile industry, and I mentioned earlier that they use this information as well. They want to understand how to improve the design of vehicles. So these are all stakeholders. Step 2 is to assess the data sources, the systems that are available. So this is the database systems that are available and the quality of information. We want to know about what information on road injuries is already collected. And we've heard already that there are many agencies, health, police, I think there are others, there are insurance companies, other organisations, road agencies, all involved in collecting information. If we're all collecting the same information, this may be a waste of resources, so we need to coordinate at least and understand what people are doing. We need to assess the data to understand things like how broad does this information cover? Is it just for one city? Is it just for one small area? Or is it for the whole country? So we can ask these questions. How does this system work? What are the processes? How do they collect their data? How do they make sure it's got good quality? What are the strengths and weaknesses of their systems? Is it a very hard system to use? Does it take a lot of money to collect the data, but it's very hard to get analysis undertaken to assess data quality? But it's things like, what do we include in our data systems? Do we include people driving only on the road, or people who are driving or riding off the road in car parks or on their own property, on a farm area? The issue about underreporting, an issue for every country around the world. What data is missing and what errors have been made in our data? We need to do an assessment of how people use this information. We've already briefly touched on this already, but there are many people around who use information and also who collect information. What are the types of users and how they use this information? So all of those stakeholders I mentioned before may use this information in different ways. The police need slightly different information to engineers. Hospitals need different information. It's really important for us as road safety managers to understand who needs this information to help us improve safety. A lot of people want to help improve safety, but they need the right information to help with this process. So we need to understand what they need so they can help us. What are their expectations? What would they like to see? Is it possible to make a small change to what we do to give them the information that they need to make a difference? What resources are required? This is the big issue. How expensive will this be to set up a new system, to improve our own system? What experience do we need to do this? You can't just walk into an organisation and make a change without understanding what changes need to be made. We need to have people that have experience to do this. We've got different methods we can use to assess the needs of our end users, the police or others. We can interview the police and ask them what they need. We can talk to them. We can do focus groups. A focus group is when we get maybe 4 or 5 people together in a room and have a discussion about what their needs are, maybe all from one organisation or from several organisations. We can do questionnaires. We can send them a questionnaire and ask them the questions to fill out. What do you need and how do you use this information? We can set up working groups to assess this for us. You might have one person responsible to ask all stakeholders, how will you use this information? What do you need that you don't have access to? It's very interesting because if you do this assessment, you might find someone has a need for information that will help us improve safety, and they were not aware that information already exists. And we can make a connection very easily, and they can access this information now. This last one, this environmental analysis, this political analysis. So this is all about involving the large number of agencies who are involved in improving safety, the different ministries of highways, transport authorities, national road safety councils, police, health, justice, all these different agencies who are working on the same problem. Everyone wants to improve road safety and all have some interest in this. We need to have engagement to bring all these different organisations together. We need to build relationships and talk to people, but we need to understand the needs of different organisations and what their expectations are. One of the biggest issues we have with our crash data systems particularly, we spend a lot of money to build a good system, but we have not done this proper assessment and discussions with other agencies, particularly the police, about their role in this process. They need to understand the importance of this task, how the information will be used, and how they can use this information themselves. So this is a very, very important step, because you could spend millions developing a new system, but no one will use it because no one wants to be involved. Forget that stage of developing a database until you have done this stage of the process, talking to people, developing these connections, understanding what they need, making sure they know the importance, making sure that they understand how they will use information as well. It is important that we make sure the police understand why other people need to use this information. And at the most senior level, at minister level, they need to reach agreement about this importance, and they need to sign agreements to say, yes, this is something we will do. It is important that we make sure the police understand why other people need to use this information. And at the most senior level, at minister level, they need to reach agreement about this importance, and they need to sign agreements to say, yes, this is something we will do. And lastly, funding, and that's going to be discussed in a later module. Obviously, money is a big problem when you try to establish or improve systems. It is expensive. So later we'll talk about some of the tools that we can use to generate funding. In the countries who do very well in road safety, there is an understanding that there is no single source of information for a crash data system. So no single crash injury database will provide enough information to give a complete picture of road traffic injuries or to fully understand the underlying injury mechanisms. This is from this group ERTAD, who is this global road safety data group. This is their understanding of this issue. So we need to collect information from not just one source, but from a number of sources. Most countries, 70% of countries, use police data to generate a database on crashes. So this is the most common approach. It is what we do in Australia. It is what is happening in most countries. So it is the main source of data for us in terms of road safety. But there are also other sources that are often equally important. Hospital data is also used as the main source. In some countries, the police don't collect this information, and so information comes from hospital systems. Other countries, and I think this is the most useful approach, use police data and hospital data, and they combine this information together. The recommendation from this global road safety group ERTAD is that the police should probably be the main source of information. And the reason for that is that police are able often to go to the location where the crash has happened on the road, And so they can gather a lot of information which is useful for many different people. So they, for that reason, should probably stay the main source of our information. But hospital data is also very, very useful as well. And that is because they collect information on the serious outcomes that sometimes the police won't know about. And we're able to compare hospital data with police data, and we can see what data is missing. Sometimes the police don't go to a crash, but the hospital may have information on that crash. There are other sources of information on crash locations that are used in different countries. Some of these are not very successful. Some give us some extra information. Some countries use the public. They use a form that people can fill out and take to the police or to the lead agency to say, I've had a crash, here is the details about this. And we can add this information sometimes to our databases. We need to be concerned about the quality, though, of this sort of information sometimes. Similarly, in our country, when a crash happens, people will come to clean up this crash. People will want to tow away a car, and they sometimes keep records as well. Ambulance keep records, ambulance service. Insurance companies will sometimes keep records. Just be aware that although this is useful additional information, it can sometimes take a lot of effort to collect because there are many different insurance companies, there are many different ambulance providers. There's no one place to go quite often. And sometimes the quality is not so good. But sometimes this can also be useful for us. So why are the police so important for our crash data? Police are able to collect information because they often go to the crash location, to where a crash has happened. They can go and they can see, is this on a corner? Is this at an intersection? The age of a person involved. Was it a child or was it someone, older person? Were they on a motorcycle? Was a truck involved? So they're able to ask questions and to complete police forms. I think many of you will understand this part of the process and how important that is. They may also receive information about a crash after it has happened. And in many countries, it is a legal requirement. It is the law that if a crash happens that involves an injury, they need to go to the police to report this. So sometimes people will come and they will fill out a form at the police station. Usually, the most common way around the world to collect this information is the paper-based form. It may be 2 pages long or maybe 4 pages long. People will fill in the details. Some of the new systems around the world use electronic type systems. They can enter into this system and it will go straight into a database. So these advanced systems are now also available. Examples of these crash report forms are available in the data systems document. So we need to focus on the most important issues, make our report forms as easy to fill in as possible, as short as possible, to make sure we get as many crashes reported as possible. So there is a balance between the amount of detail we would like against how much burden, how much time will it take for the police to do this. The more time it takes, the harder it will be. But there is guidance on this issue. Crash date, the day, crash date, the time of the crash. The location, very, very important for a number of reasons, which we'll talk about later. Weather conditions, light conditions. How serious was this? Did someone go to the hospital? Were they killed? A whole range of information about the crash itself. Information about where the crash happened, the road. And this is most useful for our engineers who try to improve the road. What type of roadway was it? Was it a motorway or was it a more local road? What was the speed environment? Was it out in the countryside where it is high speed, or was it in a busy city where it was low speed? Was it at an intersection, at a junction, or was it away from an intersection? Was it on a curve on the road? Often we find in road safety that people drive along straight roads and they come to a curve or a bend in the road, and this is where they will have a crash. If we know about this, then we're able to treat those locations because we can see where they happen. There's also a range of vehicle-related factors. What sort of vehicle type was it? Was it a motorcycle? Was it a truck? What sort of truck was it? Also information about the people involved, each person involved in the crash. Was it a pedestrian? How old were they? What was their injury? If they were in a car, where were they sitting? But also these elements about drinking, alcohol. Was speed involved? Drugs? All these other elements. And the police can usually find this information out when they go to the location and do interviews. There is a crash identifier. This will be crash number 1043. This is the crash number of this year. There will also be a linkage between all of these variables. There might be 2 vehicles involved in a crash, so we need to link that. There might be vehicle 1 involved in that crash, vehicle 2, and same as the people. There may be 8 people involved in the crash, so you need to link the crash identifier to the people. This is explained very well in the data systems documents, but things like number of lanes. How many lanes on this road? Were there 2 lanes, 4 lanes? What sort of road markings were there? Were there any road markings there? Was there a line down the centre of the road? An example. This example is in this manual. It comes from India. But it looks the same as many other forms as well. I won't go through every single question that is asked, but there is information usually at the start about location. Very useful is this area here where the police can draw a diagram of what has happened. That's also that police form. I'll move on from that. Okay, hospital data. Just very briefly on this. It's used to identify this underreporting issue that we will talk about more tomorrow. But it's also used to give us better information about the injuries that are actually occurring. So when a person is injured in a crash, the police may come and attend, and that person may be taken to hospital, or they may not be taken to hospital. The police have good understanding about injuries, but they're not the experts that doctors are. Doctors are the experts on injuries. So that is one of the good reasons for us to link with hospital information as well. The medical profession at the global level, international level, has developed methods for recording systems for hospitals. There are different classifications that they use for injury, and these have different names. There is the International Classification of Disease, the ICD. There is also the Abbreviated Injury Scale, the AIS. So in this case, this is our victims. The police may or may not be involved and fill out a report, so we may get some information from the police. And in the case of Cambodia, this is fed into the Ministry of the Interior, just the traffic police data only, and then that gets into their National Road Safety Committee and into their database. Some people may not the police may not be aware of some of these crashes that occur, but they may go to a public health facility or to a private clinic. And in this case, the Ministry of Health has a system, the injury surveillance system, that they can collect information as well. And this information is joined by the National Road Safety Committee. This is not an easy task because sometimes it may be the same crash, sometimes it may be different crashes, and they need to do this work to make sure it's not double counting the same crash. This is to remind me that it's not just the crash data that we need to collect. We need to collect other information as well. You remember we need to collect the indicators. How much additional resource is being spent on speed enforcement? How many schools have we got education programs in? But also in terms of our outcomes, some of our behaviours. What has been the effect on speed? What is the changes in speed? But also there's information about the road environment, which helps us when our crash data isn't so good. Sometimes, so what are these additional sources of information that we may already be collecting? The first one there is road inventory, and I'll explain that in a bit more detail. Traffic data in terms of traffic volumes, speeds, and these sorts of things. Other exposure data, things like the number of people in the population, how many people live in our country or in different parts of the country. Attitude surveys. This is also an important measure for us to collect information on. If we're doing a speed enforcement program, a campaign to change people's understanding about speed, we need to do surveys of people to ask them the questions. What do you know about speed? Is this dangerous? Yes or no? And we can do surveys, which is also very useful. And you will find universities may be already doing this data collection for us. Road inventory. What is road inventory? This is the information about the road itself. And it is very, very important, particularly for people who work to build new roads or to improve our existing roads. The type of road. Is this roadway a highway, a motorway, or is it a local road? Is it in a rural area, or is it in a city? What are the number of lanes? What is the width of the road? Is it an intersection? Where are the intersections along this network? What is the speed limit on these roads? Sometimes people collect information about some of the hazards on the side of the road. Is there a big, big tree near to the side of the road? Some people collect this information for us already. What are the pedestrian facilities that are already in place? You'll find that in some of your countries, some organisations already collect this information. And we can link our crash data to this source of information to help us understand crashes better, to help us understand risk. The last point is very important. The data may already exist. There may already be people spending a lot of money in your country collecting this information. It may already exist. So you need to find out about this and ask if it is already around. That is part of this situational assessment we mentioned earlier. We need to ask our stakeholders, what are they doing? What do they collect? I'll explain more about this road inventory because it's probably, apart from crash data, one of our major sources of information for managing safety. But what we can do is, based on our understanding about the roads, we can do calculations based on this information to have an estimate about risk. So if you imagine, if we have a knowledge about the road, if you've got a straight road, would this be more risky or less risky than a road with a bend in it? And the answer is a straight road will be safer than a road with a bend in it. Similarly, if you have a wide road, this will be safer than a narrow road. If you have a road that has trees all the way along the side of it, near to the road, and this is a high-speed road, this will be less safe than a road with no trees. If we collect all this sort of information on our road design and roadside design, we can actually make calculations about, will this road be more dangerous than another piece of road? The International Road Assessment Program that we have helped develop does exactly the same process. So they collect all this information that relates to road safety outcomes, and they will calculate for you how risky a road is. And you can join this information together with your crash information, but it will tell particularly your road designers and road engineers where the changes should happen. What are the major risk causes on this roadway? This is very, very important information as well. It can be very expensive to collect this information, but again, it may already be collected by particularly your people in asset management, people who maintain the roads in your country, may already collect all of this information already. So these sorts of vehicles, cameras on top, collecting video data, and then back in the office, we can sit down and look at these video images, and we can assess how wide is this road, how much of a bend in this road, is there a hazard, is there a tree on the side of the road? And they can enter this information into a database. And this gives information for our asset managers and our people who maintain roads, our roads departments, very important information for them, but also very important information for us in managing road safety. If we collect this already, we can already calculate where crashes might happen. Traffic data. Often people collect information about how busy roads are, how many motorcycles use this road, how many pedestrians walk along this road. Sometimes we do these surveys for other planning purposes in our countries, but it is also useful information for road safety. Traffic volumes can be joined together with information on crash locations as well, and we can get some powerful analysis, which I'll talk about later, using these combinations of information. Traffic mix. You can do a survey on the road and see where are the trucks. Are there many trucks, or are there mostly motorcycles here, or are there many cars here? This is also useful information to understand some of our crash problem types. Vehicle speeds, very important. Do we have roads where there are schools and speeds are very high, where children are crossing the roads? It is useful for us to understand our crash problems if we have information on things like speed as well. We can collect this information through people on the side of the road counting. We can actually put down equipment on the road surface as well, which automatically collects this information. It goes straight into a system that records the number of vehicles, the different types of vehicles, the speeds of vehicles. In some of our countries now, we make a hole in the road, and under the road itself, we put in detectors that can detect vehicles going over. Even if it's a motorcycle, we know, and it can count every day of the year, we know how many vehicles. We wouldn't do this for every road, that's very expensive. But for our major roads, we can use this information as well. This is used by other parts of road agencies, but it can be used for road safety as well. This last point is very exciting. Most people who are on motorcycles or in cars, many people now have mobile phones. This is a new technology that is easy to access. When you use your mobile phone, sometimes it'll have a link to a satellite, GPS. And so this will know where people are on the road. We now have access to this mobile phone technology. This technology is something for you to be aware of in future. It is very useful to access. It will mean you don't need to collect information from everywhere else. If you would like this technology, then you need to start thinking about this and doing a stakeholder analysis. The telecommunications companies in your country, do they allow access to this information for government? This is part of the stakeholder group now. I won't go through all of these in detail, but population data, this is things like the number of people who live in your country, the number of people by different age groups, how many children, how many adults. And this might cover the whole country or different areas within your country. This is important to combine with crash data to help us make comparisons. You might have one area where there are 1,000 people in a crash, and the area next door might be only 500 people have a crash. But it may be that the area with 500 people has a very small population, so something is going wrong in this area. So it is important to understand how many people live or drive in an area to know more about your crash problems. Attitude surveys I've already mentioned. What do people think about speed? What do they think about using speed cameras? Do they think this is for making money only? We can do these attitude surveys, and over time we can see a change in people's behaviour. Vehicle registration details. This is often stored by some organisations, government agencies in our countries. We can access this information and include this in our crash data sometimes. This one, maintenance and operations files. Road agencies again collect information about where they will be maintaining the roads in the future, or where they have recently maintained the roads. They've been out and they want to make the road smoother, no holes in the road. And maybe in 1 year's time they will go to a road to improve that and fix the holes in the road. But at the same time, when they spend all this money fixing this road, we can say, please make some safety improvements at the same time. And it is cheaper when we do that at one time. Operations files, we may be able to identify improvements that have already taken place. Again, improvements that may have worked or may not have worked. So project history files as well, similar projects that have taken place. Insurance companies we've spoken about, they collect information as well. Weather's interesting. In many countries there is a direct linkage between heavy rain and road safety outcomes. Sometimes when there is on the road dirt and other things and it rains, the road becomes very slippery. So it is sometimes useful to know weather reports. We collect this information as well. And lastly, vehicle information, vehicle data. In Australia, we collect information about the number of vehicles sold every year, what type of vehicles and how safe they are. And in Australia, we have star ratings on cars. 5-star safe car, 1-star not a safe car. And over time, we have tracked the change. And now almost every new car that is bought is a 5-star car because people understand it is best to have a safe car. So vehicle data can also be used and is interesting.